Good afternoon, class.
Good afternoon, sir.
Okay, before we start, let's all stand up and I will lead you in a prayer. Lord, thank you for this day. Thank you for loving us unconditionally. Help us to grow in knowledge as we study for today's lesson. Give my students a wisdom and presence of mind. All this we ask in your mighty name. Amen. Good afternoon again, class.
Good afternoon, sir.
Before you take your seat, kindly pick up the trash underneath your chair. And now, I will check your attendance first. Is there any absent for today's class?
None, sir.
Okay, very good. There is no absent for today. Before we formally start, let's have an icebreaker first. The name of the icebreaker is called Guess the Picture Beshiko. All you need to do is to guess the picture in your screen. Are you ready, class?
Yes, sir.
Okay, let's start. Here is the first picture.
Sir.
Yes? Yes?
Sir, albulario.
Very good. That's albulario. Next picture. Yes, Trixie?
Magtatawa, sir.
Very good. That's magtatawas. Next picture.
Sir?
Yes, Edbian?
Manghilot po.
Very good. That's manghilot. The next picture.
Sir,
Yes, Daniela?
device quackery po.
Yes, that's correct. That's device quackery. And last picture.
Sir,
Yes, Charmaine?
medicinal quackery.
Very good. That's medicinal quackery. We will tackle all those terms in our discussion. Here is our objectives. At the end of the lesson, students should be able to first identify different types of quackery and categorize 10 herbal medicines approved by the Department of Health. Second, express their attitudes and beliefs regarding the use of herbal medicines and quackery, considering cultural, social, and personal perspective. And lastly, engage in an infographic activity promoting herbal medicines and awareness in quackery, demonstrating effective communication skills. So, let's start. Our topic for today is different types of quackery. First, what is quack? So, quacks are people who perform healing procedures or prescribe remedies for illnesses, even without formal education and licenses. So, yung mga quack daw, ito yung mga tao na nagpa-perform ng mga healing procedures kahit hindi naman ito nila pinag-aralan or wala silang lisensya dito. Kumbaga, namana lang nila ito sa mga ninuno nila or tinuruan lang sila. And next, ano naman yung Quackery? What is Quackery? So, Quackery involves the use of methods or remedies to cure diseases that are not scientifically accepted. The promotion of fraudulent medicines or cures in order to make money. So, yung Quackery naman, ito yung mga methods or process na ina-apply sa mga patient ng mga quacks. Ginagawa nila ito para kumita ng pera kahit hindi naman ito scientifically accepted talaga. Next. History of Quackery. Ano nga ba yung pinagmulan ng Quackery? So, originating in Europe in the Middle Ages, in the 17th and 18th centuries, Quackery became more widespread in Britain as people sought to capitalize on the public's new interest in science by performing medical shows on the streets in order to capture their interest. They also provided a cheap alternative to physicians or an apothecary. So, nagmula daw yung Quackery sa Europe in year Middle Ages, 17th or 18th century. So, lumaganap daw ito sa pamagitan ng pag-apply nila or paggawa nila ng mga different Quackery sa mga daan. Kaya, lumaganap ito. Next is, there are different types of Quackery. Ano nga ba yung mga different types ng mga Quackery? So, first is charlatans. Ano nga ba yung charlatans? So, quacks that deliberately deceive their patients using charm and manipulation. So, for example, may lumapit na patient sa isang quacks. Sasabihin nila, kaya lumala yung sakit mo dahil hindi naman talaga magaling yung mga doktor. Lumala yung sakit mo dahil sa mga doktor na yan. So, dinideceive nila yung mga patients nila using charm and manipulation sa mga mabulaklak na salita. So, next naman is pranks. Those who believe that their practices are effective despite the lack of evidence. Yung mga pranks naman, pinaniniwalaan nila na effective yung mga procedures na ginagawa nila or mga practices. Yun nga, dinideceive lang nila din yung mga patients nila kahit wala naman talaga itong mga evidences or di nila ito pinag-aralan talaga. And next naman is hucksters. People who use Quackery as an opportunity for financial gain para kumita ng pera. Yan. Ginagawa lang nila ito para magkaroon ng maraming pera at yumaman sila. However, there are three forms of Quackery. So, first is medical Quackery. A drugless or bloodless medical treatment cures and remedies of various health condition. Ito na naman, pinag-uusapan dito is treatment panggagamot. For example, a person who is not a surgeon perform a surgery operation for the lumps such as goiter without opening the lump and wound. The quack use leaves of local plants for surgery. So yung una daw example is yung tao na hindi naman surgeon pero nagpe-perform siya ng surgery. Yan. Ginagamot niya yung goiter using leaves lang. So, yung tao na yon, nilalagay mo lang yung sarili mo sa kapahamakan kasi hindi naman talaga pinag-aralan nila yon. Hindi siya nag-aral ng surgery. Next naman is a person who perform a bloodless surgery operation for a wounded soldier who has bullet on his body. So for example, yung mga nakikita natin sa TV, di ba madalas sa kanila pag nabaril sila, sila lang din yung gumagamot nito. Nilalagyan nila ng benda para matigil yung pagdugo. Next naman, a simple operation of warts using ginger. Yan. Napapanood din natin sa mga TV na gumagamit lang sila ng mga oil or ointment para matanggal yung mga warts. So, safe nga ba ang mga ito? Di natin alam. Slimming lotion. This product promises to burn fat within 2 weeks of usage without surgery, even is not true. So, yung slimming lotion naman, pinapromise nila na pag ginamit natin ito, papayat tayo. So, ano nga ba yung kaugnayan ng pagpahid sa pagpayat, no? So, kumbaga napaka-unrealistic. Next naman is nutrition Quackery. This involves the promotion of food fads who claim that their product contains natural nutritional properties coming from multiple plants. So, dito naman, pinopromote nila na yung products nila, especially yung mga food fads, is effective at nagko-contain ito ng mga multiple plants. For example, most of the consumers around the world are now health conscious and it is now a trend. Quack producers responded to that trend and produced 5-in-1 mixed slimming, anti-aging, anti-cancer, detox, and whitening herbal tea. So for example, yung mga product na inaalok nila sa atin, pinaniniwalaan nila na mabisa ito. 5-in-1, sabi nga. Meron na yung anti-aging, anti-cancer, detox, whitening herbal tea. So, napaka-unrealistic din ng ganon. Next, products who can extend life and promise that it will help to increase life for almost 10 years after usage. For example, yung gamot na to, sinasabi ng mga quack na pag daw ininom natin ito, hahaba yung buhay natin. Yan. Next naman is liquid products that are diluted to water are sold and promised to cure cancers and other lumps. So, napaka-common nito, no? Yung iba, nagbebenta sila ng mga products nila or mga gamot na nag-cure ng cancers. Alam naman natin na sa ngayong araw na ito, marami yung mga taong nagkaka-cancer. Kaya umaasa sila na magagamot sila. Kaya lumalapit sila sa mga wax. Next is device quackery. It refers to the promotion or sale of fraudulent or ineffective medical devices that claim to have health benefits without scientific evidence. These devices often make exaggerated or false claims about their capabilities to treat or cure various health conditions. So, ito namang device quackery na to, pinaniniwalaan na, for example, may susuot lang tayo na kwintas or bracelet. Pag sinuot natin ito, hindi na tayo magkakasakit or hindi tayo madadapuan ng sakit. So, for example, magnetic bracelet, gaya ng sinabi ko kanina. Devices that claim to improve health by using magnetic fields, often marked for pain relief or enhanced energy. Scientific evidence supporting these claims is usually lacking. So, kagaya ng sinabi ko kanina, yung bracelet, pinaniniwalaan nila na pagsuot nila yon, lumalakas sila. So, next naman is ionic food detox machine. Devices that claim to detoxify the body by immersing faith in an ionic bath. The science behind these devices is questionable and they are often considered ineffective. So yung food detox naman, hindi pa talaga siya proven and tested. Kumbaga, ito ay ineffective, kino-consider ineffective. Hindi talaga siya nakakapag-detox ng ating body. So, next is possible effects of quackery. Ano nga ba yung mga epekto ng quackery? Next, a sick person who goes to a quack for treatment instead of a doctor may only be prolonging his or her illnesses. So, for example, yung taong may sakit daw, napupunta sa isang quack instead sa doctor. So, imbis na matreat yung sakit niya, lalo pa rin itong lalala. Magiging worse lang yung condition niya. Next, even if no actual healing has been done, the patient gets malwarely by his or her own faith, either in the quack or in the remedies given. So, for example, may taong lumapit sa isang quack. After nung katapos ng procedure na ginawa nila, naramdaman niya na parang lumakas siya or nawala. Pero after ilang days lang, nung nagpa-check up siya, malalaman pala na mas lalo lang lumala yung kanyang condition. Kumbaga, pinaniniwalaan nila na effective iyon. Next, money wasted since patient's condition will not improve under a quack. So, syempre, sa paglapit natin sa quack, nagbabayad tayo ng pera. So, nasasayang lang yung pera natin imbis na pumunta tayo sa mga doktor talaga and talagang license. So, lalo lang, yun nga, gaya ng sinabi ko kanina, lalo lang nagiging worse yung condition natin or yung sakit natin. Nasasayang lang lalo yung pera natin. Next, the patient's family may only get false hope if the quack assures them of the patient's complete healing. So, for example, lumapit ako sa isang quack. So, syempre, ipapromise niya na gagaling ako, mawawala yung sakit ko. So, mabibigyan ka lang ng mga false hope na gagaling ka. Pero, in real life, hindi talaga. Next naman, how to identify medical quacks. First, some of them utilize advertisements to promote their products. So, ngayon, marami ng mga nagpo-promote ng mga products sa social media para maging mabenta yung kanilang products. Siyempre, magpo-promote yung mga yan. Next naman is, most of them perform their services in their homes. Yung iba naman, nagpe-perform sa bahay-bahay nila and ilalive nila yon para maengganyo yung mga tao. Next naman, Some claim to have secret formulas which cannot be obtained from drugstore. So yung iba naman sasabihan na meron daw silang secret formula na hindi may bibili sa mga drugstore. Kumbaga sa kanila lang mabibili yung mga yon. So those people are medical quacks. Next naman, some of them perform their services without regard for sanitation. Magpe-perform sila ng mga different procedures or services na wala namang itong sanitation. Kumbaga hindi ito gumamit ng mga iba't ibang cleaning sanitation. Next naman, some utter bug prayers or incantations while they are treating their patients. Alam na natin to sa mga napapanood natin sa mga TV na habang nagtitreatment sila, meron silang ginagawang mga prayers or yung mga speaking in tongues, sabi nga. Next naman, most of them use the same procedure or medicinal formula for all kinds of illnesses. Yan, napaka-common nito. Yung mga lahat ng sakit na lahat ng pumupunta sa isang quack, pare-parehas lang yung sinasabi ng quack. Inom ka ng ganito, inom ka ng ganyan. So, pare-parehas lang. So, those people are medical quacks. So, sino nga ba yung usual victim of medical quackery? So, first, suffer from serious ailment or diseases like cancer, heart problem, or etc. So, yung madalas daw na victims ng quackery is yung mga may taong merong malabhang karamdaman like cancer, heart problem, kaya umaasa sila na sa quacks gagaling sila. Next naman, are afraid of doctors or refuse to undergo surgery although they have been advised to do so by doctors. Yan, napaka-common nito. Most victims ng quackery is yung mga takot sa mga doktor, takot sa mga hospital, kaya sa mga quack sila lumalapit. Next naman, patients that have lack of money or can't afford to go in hospital. Alam naman natin na yung pagpunta sa hospital ngayon, napaka-mahal. Kaya yung most of the patients, naghahanap sila ng alternative na mas mura. Kaya lumalapit sila sa mga quacks.
And now, let's proceed to protect your health and your pocket by taking the following precautions. First is do not trust your health to a salesperson, ad, or TV infomercial. Take the time to find a credentialed primary health care provider that can trust to give you sound medical advice. So, importante para sa mga individuals na mag-rely on trained and credentialed healthcare professionals for accurate and trustworthy advice. So, while yung advertisements and informationals may offer information, they often have a commercial interest and may not prioritize your health needs. So, establishing a relationship with a primary healthcare provider tulad ng doctor or yung mga nurses is important para sa personalized and evidence-based medical advice. So, tandaan natin everyone, tandaan natin students na i-prioritize yung health by seeking information from reputable resources and consulting with qualified healthcare professionals kapag gumagawa ng mga decisions about well-being. And now, let's proceed to the second bullet. Do not believe claims that a secret or miracle drug will work wonders on a wide variety of elements. So, it's wise to approach claims for a secret or miracle drug with skepticism. Tulad ng assertions often lack scientific evidence and may be driven by marketing strategies rather than genuine effectiveness. So, yung health and medical treatments should be based on research, critical trials, and yung mga peers reviews evidence. Kapag nagko-consider tayo ng bagong drug or treatment, importante na magpa-consult muna tayo sa reliable resources such as healthcare professionals, scientific studies, and yung mga reputable medical organizations. Maging maingat sa mga products that promise extraordinary benefits without providing substantial evidence to support their claims. Tandaan everyone that health is a complex and individual matter. And what works for one person may not necessarily work for others. And now let's proceed to the third bullet. Do not buy medical devices, bracelets, or other products without first consulting your doctor or other appropriate health professionals. So, tama nga naman. Importante na sundan yung advice na to. Purchasing medical advices, bracelets, or yung other health-related products without consulting a qualified healthcare professional can pose serious risk to your health. Your doctor or healthcare professionals can provide personalized advice, assess whether a particular product is suitable para sa'yo, and yung maka-ensure tayo that it is complements your overall health and wellness plan. So, palagi mong i-prioritize yung health mo and well-being by seeking professional advice before ka gumamit ng medical devices or yung health products, especially if they claim to have therapeutic or diagnostic benefits. Now, let's proceed to the fourth bullet. Do not buy any product based on the seller's claim that the purchase will be covered by Medicare or other insurance. So, it is important to exercise caution and skepticism when considering purchases based sa mga seller's claims na yung product will be covered by Medicare or other health insurance. Yung mga sellers may make promises or assurances about sa coverage, pero importante na i-verify yung ganung claims. Then, contact your insurance provider directly to confirm coverage for a specific product or services. So, before ka mag-purchase ng product na nag-claim na covered nila yung health insurance, i-consult mo muna yung healthcare provider mo or other relevant professionals. Kasi they can provide guidance sa product for your needs and help verify any claims by their sellers. And now, let's move on to practitioners of traditional medicine. So, may papakita ko sa inyo students na picture kung ano nga ba yung hilot or manghihilot. Ayan siya, everyone. So, yung manghihilot acts as a midwife, a chiropractor, or massage therapist to promote health and healing. So, these professions contribute to promoting health and healing in different ways. And yung mga individuals may choose this service based sa specific needs and preferences nila. So, it's important to seek services from qualified and licensed professionals in each field and to makipag-communicate openly with healthcare providers na para ma-ensure na yung chosen therapist align with individuals' goals, health. Now, let's proceed to tawas or mangtatawas. Ito yung example picture niya, everyone. So, mangtatawas, this practitioner uses alum, candles, smoke, papers, eggs, and other mediums to diagnose the cause of illness associated by prayers and incantations. So, people seeking such services may do so for a variety of reasons, including yung cultural beliefs, yung personal spirituality, or a desire para sa alternative healing methods. If kino-consider mo yung pag-participate sa mga ganong practices, importante na mag-approach sa kanila with an open mind and respect. Additionally, na dito yung it's recommended to seek guidance from qualified practitioners who operate within ethical and legal boundaries. And now, let's proceed to albularyo. So, ito yung sample picture niya, class. Kung nakikita nyo. Okay, so, a general practitioner who uses a combination of healing modalities that may include prayers, incantations, mysticism, and herbalism. So, yung mga general practitioners, pwede nilang gamitin yung modalities na to alongside conventional medical treatments, recognizing that a comprehensive approach to health involves addressing na hindi lang sa physical symptoms but also emotional and spiritual aspects. So, it is important na alam natin that while these practices may be meaningful for some individuals, they should be used ethically and with consideration of the patient's preferences and beliefs. If you are considering seeing a healthcare practitioners who incorporates these modalities, it's advisable to makipag-communicate openly with them about your health goals, concerns, and preferences. And now, let's proceed to faith healers. So, ito yung example picture niya, class. So, a practitioner who claims divine power bestowed by the Holy Spirit or God. A patient is required to have faith and believe in divine powers to effect healing. So, a practitioner na nag-claim to have divine power bestowed by the Holy Spirit or God, and ina-emphasize niya yung role of faith in the healing process, is often associated with spiritual or faith-based healing. So, it is important para sa individuals na mag-seek such services to be aware of these practices and para ma-inform sila about decisions based on their personal beliefs and values. Okay, class, take note. Kailangan nating tandaan na yung quackery, ito ay mga informations about treatment na kung saan ito ay nanggagaling at napapasa mula sa mga ating mga ninuno. We can say na purely negative ito or ineffective dahil noong unang panahon, wala pa namang gaanong doctors noon at umaasa lang yung mga tao noon sa quackery. Pero masasabi natin na marami ang mga gumagaling noon. But in our generation ngayon, napaka-risky na ng ganitong procedure. That's why quackery is very important matter. We need to be educated about this. So, ngayon naman, magkakaroon tayo ng graded recitation. Meron akong inihandang quote dito na nagsasabing, "A rubber demands your money or your life, but a quack demands your money and your life." So, ngayon, based sa nabasa nyo, class, are you agree or disagree? And why?
Ma'am?
Yes, Raymond? Okay. Very good insights, Raymond. Tama nga naman, dahil yung magnanakaw, magdademand lang siya whether kung buhay mo or money. But, it's either lang sa kanilang dalawa, pero yung quackery is magdademand siya both ng buhay mo at pera. Dahil mapapagastos ka na, malalagay pa sa peligro ang iyong buhay. And now, class, that's the end of the discussion about quackery. And now, let's proceed to the next topic. But before that, we have an icebreaker. It is Guess the Picture Beshiko. And mag-raise lang kayo ng hand if alam niyo yung sagot, okay? Yes, Edvian?
Lagundi po.
Okay, let's check. Okay, that's correct. Second picture. Yes, Daniela?
Bayabas po.
Okay, that's correct. Third picture. Yes, Angelica?
Bawang po.
Let's check. Okay, that's correct. And yes, Charmaine.
Ampalaya po.
Let's check. Okay, that's correct also.
Ma'am?
Yes, Raymond.
Acapulco, ma'am.
Okay, that's also correct. So now, let's proceed to the herbal medicine, which will be discussed by Angelica Sanchez.
Okay, class, so let me introduce you what is herbal medicine. So what is herbal medicine? Anyone from you, class? Okay, so herbal medicine, it refers to using a plant seeds, roots, leaves, or flowers for medical purposes. It is essentially for us to use these plants because it helps us to improve our health and to treat a certain illness. So herbal comes from the Greek word herba, which means grass or green plant. So medicine is any substance used to treat or prevent an illness or ailment. Simply means medicine helps our bodies to function and fight off a harmful substance and keep us healthy. So now, why DOH is advocating the use of herbal plants as part of primary healthcare, and it is because the increasing cost of drugs. So the DOH advocates the use of herbal plants because they can be natural, affordable, and it is accessible way to maintain our health and treat a certain illness. Here's a simple way, class, to understand it better. So imagine you have a garden in your backyard with a different kind of plants. Some of these plants are like oregano, ginger, or peppermint that can help with things like stomach ache or cold or a cough. Instead of going to pharmacy, you could use these plants to help you feel better. This is especially helpful for those people who may not have an easy access to conventional medicine or who cannot afford it. Plus, because these are natural plants, they have often have a fewer side effects than any synthetic drugs. However, it is important to remember, class, that while herbal plants can be beneficial, they should be used responsibly and under guidance of a healthcare provider. So now let's proceed, or let me introduce you to the Republic Act of 8423, also known as the Traditional and Alternative Medicine Act of 1997. So, for you to understand this law, imagine you have a friend who knows a lot about different ways to stay healthy. They know about not only regular medicine that doctors can give them or doctors can give you, but also about others' way to feel better, like using natural herbs or medical medicine. So class, the Traditional and Alternative Medicine Act of 1997 is a law that says it is important to learn about and use these different ways to stay healthy. This law created a special group called the Philippine Institute of Traditional and Alternative Health Care, or also known as PITAC, that helps or make sure the people know about these different ways to stay healthy. They also help to make sure that the medicine and treatments used in these alternative ways are safe and effective. They want to make sure that everyone has an access to these different ways to stay healthy. So they work to make them more available to people. So the law is all about recognizing and supporting different ways to stay healthy, like using natural herbs or doing special exercises alongside the regular medicine that doctors can give you. It is like having more options to feel better and stay healthy. Since then, the Philippine Department of Health, or the DOH, through its traditional health program, has endorsed 10 medicinal plants to be used as a herbal medicine in the Philippines due to its health benefits. So, simula noon, class, ang DOH ay nag-endorse ng 10 medicinal plants sa Pilipinas dahil sa health benefits nito. And ito ay ating malalaman sa susunod na discussion.
And now let's move on to the 10 herbal medicines approved by the DOH. And just for you to know, class, over thousands of herbal medicines are available in the Philippines. Pero ito lamang yung mga na-approve ng DOH. And may pictures ako dito para malaman nyo kung ano yung itsura ng mga plants na yon. Okay? First is we have the sambong, also known as Blumea balsamifera. Isa siyang medicinal plant na native sa Southeast Asia. Kasama na dito yung Pilipinas, yung India, and yung China. Ginagamit siya as a traditional Asian medicine for a very long time. Ginagamit din siya panggamot sa anti-edema, diuretic, and yung plant na to, tumataas siya ng 1 to 3 meters. And as you can see, yung leaves niya is hairy. So, paano nga ba ito gawing herbal? First is, i-chop muna yung leaves and pakulaan ito for 15 minutes. Dapat yung dami is abot hanggang 3 glass kasi iinumin siya for 3 times a day. Morning, afternoon, and evening. And take note, sambong is not a medicine for kidney infection. Next is we have the Acapulco, also known as Dicena alata or Cassia alata, is a shrub and native to tropical regions including the Philippines. Ginagamit siya panggamot sa skin condition. Acapulco kasi contains cryophenol acids na effective sa pag-treat ng skin disease, gaya ng antifungal or specifically Taenia lava, ringworm, athlete's foot, and scabies. So, paano nga ba ito gamitin? Kukuha tayo ng matured leaves, gagawin siyang sabon para isasabon mo siya sa skin and apply it 2 times a day. The third one is Nugnugan, also known as Quisqualis indica or Rangon creeper. Is a vine that is native to tropical regions including the Philippines. Isa sa mga nagagamit ito ay anti-helminthic. Ginagamit siya para patayin yung parasitic worms. Sa preparation naman nito, kakainin siya ng raw last meal bago matulog yung pasyente. Yung adults, pwede silang kumain ng 10 seeds, and sa mga bata naman ay 6 seeds. And take note, dito pwede ipakain sa 4 years below. Better na ipacheck up na lang sa doctor or need talaga ng doctor's prescription. The next one is we have the chaang gubat, also known as Carmona retusa. Is a shrub or small tree na native sa Philippines. Yung ginagamot niya is diarrhea and stomach ache. Sa preparation naman nito is huhugasan and pakukuluan yung leaves for 15 minutes. Kailangan yung pinagkuluan, aabot siya ng 2 glasses kasi kailangan siyang inumin 2 times a day.
Now, let's proceed sa ampalaya. Ang ampalaya ay isang halamang umaakyat na may mahabang tangkay na umaabot ng 20 cm. Yung mga dahon nito ay hugis puso at may sukat na 5 hanggang 10 cm sa diameter. Ang bunga nito ay green, may kulubot sa ibabaw at mapait ang lasa nito. Saan nga ba ginagamit ito? Ito ay nakakababa ng sugar level sa dugo. Epektibo rin sa diabetes mellitus. Paano ito gamitin? Kunin at hugasan ng mabuti ang mga batang dahon, hiwain at pakuluan ito sa 2 basong tubig ng 15 minutes sa mababang apoy. Huwag takpan ang kaldero, palamigin at salain. Uminom ng 3 beses isang araw pagkatapos kumain. Now, let's proceed na sa lagundi. Ang lagundi o kilala rin bilang 5-leaf chest tree ay isang halamang mababa na tumutubo sa mga bakanting lote. Ang bulaklak nito ay kulay asul at hugis bell. Ginagamit ito sa gamot sa hika at ubo, lagnat, dysenteria, sipon, sakit sa balat at sakit ng ulo. Ano nga ba ang preparation nito? Para sa hika, ubo at lagnat, kumuha ng dahon at pakuluan sa 2 basong tubig hanggang maging 1 baso na lamang. Ito ay nagbabago depende kung saan gagamitin. So now, let's proceed to sa ulasimang bato. Ulasimang bato ay isang damo na may mga dahong parang puso na tumutubo sa ilalim ng hardin at bakuran. Ginagamit ito dahil nakakababa ng uric acid o rheuma o gout. Paano ginagamit ito? Hugasan ng mabuti ang mga dahon, pakuluan sa 2 baso ng tubig sa mababang apoy. Huwag takpan ng kaldero, palamigin at pagkatapos hatiin sa 3 bahagi at inumin ito 3 beses sa isang araw. At ngayon naman, dumako tayo dun sa bawang. Ang bawang ay isang mahabang halaman na umaabot ng 60 cm ang taas. Ginagamit ito para sa hypertension, sakit ng ngipin at nakakababa ito ng kolesterol sa dugo. Paano ito gamitin? Pwedeng prituhin at pagkatapos iprito, ilulubog siya sa suka ng 30 minutes at pagkatapos ibababad sa kumukulong tubig ng 15 minutes. Now, let's proceed on bayabas. Ang bayabas ay isang puno na umaabot ng 4 hanggang 5 cm ang taas na may maliit na puting bulaklak. Ginagamit ito panghugas ng sugat para sa sakit ng ngipin at para sa pagtatae. Paano nga ba ito gamitin? Hugasan at hiwain ng mabuti ang mga dahon. Pakuluan ng 15 minutes sa mababang apoy. Huwag takpan ng kaldero, palamigin at salain bago gamitin. Ngayon naman, dumako naman tayo sa yerba buena. Yerba buena ay isang maliit na mabangong halaman. Ang mga dahon ay maliit at may ngipin sa gilid. Ang tangkay nito ay nakadikit sa lupa. Saan naman ito ginagamit? Sa mga sakit sa iba't ibang bahagi ng katawan tulad ng sakit ng ulo, sakit ng tiyan, rheuma, arthritis, sakit ng ulo, ubo at sipon. Para sa paghahanda, para sa mga sakit sa iba't ibang bahagi ng katawan, Pakuluan at iwain ang dahon sa 2 basong tubig ng 15 minutes at palamigin. Ito ay nagbabago depende kung saan gagamitin.
Ngayon naman, nalaman natin ang 10 herbal medicines approved by the DOH. Magbibigay ako ng summary nito. So, ito ang mga lagundi, ulasimang bato, guava, bayabas, garlic, yerba buena, sambong, akapulko, niyog-niyugan, tsaang gubat, at ampalaya. Ngayon naman, darako tayo sa importance of herbal medicines o ang kahalagahan ng herbal medicines. So, the importance of herbal medicines lies in their natural healing properties derived from plants. So, napakahalaga nito dahil taglay nito ang natural healing effect na kung saan nanggaling ito sa kanyang mga dahon, sa kanyang mga roots. Kasama dito ang natural healing. Herbal medicines are derived from natural sources such as leaves, roots, and flowers. This aligns with a preference for natural and holistic approaches to healthcare. Dahil nga, gaya ng sinabi ko kanina, ito ay may natural healing effect na kung saan napaka-safe gamitin ng mga ito at marami itong taglay na positive benefits sa ating katawan. Next is cultural significance. Herbal remedies often play significant role in cultural practices and rituals, contributing to the preservation of cultural heritage and knowledge. So, ang herbal medicines, ito din ay ating cultural significance. Mahalaga ito sa ating kultura dahil dito nape-preserve ang ating cultural heritage. Next naman, accessible and affordable. In many cases, herbal medicines are more accessible and affordable compared to synthetic pharmaceuticals. This can be particularly important in regions with limited access to modern healthcare. So, napakahalaga ng point na to. Dahil dito sinasabi na accessible lang ito. Bakit? Dahil nakukuha lang natin ito sa likod ng ating bahay or nahihingi lang natin ito. Napaka-accessible. Affordable naman dahil minsan kahit hindi natin ito bayaran, kahit humingi lang tayo or mismong tanim natin, may makukuha tayo. So, napaka-affordable nito. Hindi na natin kailangan gumastos. Ngayon naman, magkakaroon tayo ng activity. Ito ay ang infographic activity. You need to make an infographic about promoting herbal medicines and awareness of Quackery. Here is the rubrics of the activity. First, content. Second, relevance. Third, creativity. And lastly, presentation. So now, we will have a graded recitation. The question is, what are your reflections for our today's topic? Yes, Edvian. Very good. So, napakahalaga nga na pag-usapan or ma-educate about sa Quackery. Kailangan nating maging aware dahil maaring malagay sa risk yung ating buhay dahil buhay yung pinag-uusapan dito. Kung hindi tayo magiging aware dito, maaring malagay sa peligro yung ating mga pamilya or ating sariling katawan. Yes, Angelica? Very good. So, napakahalaga nga na malaman natin yung mga 10 herbal medicines. Dahil dito, magiging aware tayo kung ano lang yung pwede nating gamitin, kung ano yung pwedeng safe nating gamitin. At nalaman natin yung mga benefits doon. So, very good class. Thank you for participating in our graded recitation. And now, we will have an assignment. So first, you need to discuss the importance of educating oneself about deceptive health practices and its implications on personal well-being healthcare systems, and society. Next, what is the importance of understanding the cultural and chemical aspects of 10 approved herbal medicines contribute to making informed and effective health choices? Provide examples to support your explanations. With that, that's all for today. Thank you for listening and participating actively. Good day, class!
Good day,
Yes,
sir.
sir.